COVID-19 is susceptible of infecting anyone. The question is, what should be the public policy response? What should government do about this pandemic? Of course, it's about health first and foremost. But it's also about involuntary employments, which is significantly going up. It's also about GDP, output, trades, which is going down. It's also about schools' days, which are being lost. It's about social questions, with people being confined at homes. And it's about consumption levels, which are also gradually going down. We have to look at all those questions as one whole, as one body where we have to address specific measures. We at White Shield Partners look at it from two perspectives. On one hand, you have to look at containment measures. On the other hand, you have to look at supportive measures. Those two go hand in hand. And the way we scale it from a level 5, which is the lowest level, to a level 1. Similarly to the DEFCON levels in the defense area. Concretely, when you apply this to the epidemiologic model, this is how it scales. On the vertical axis, you have the infected rate. On the horizontal axis, you have the number of days where the infection is going through. Here, you have the thresholds of the hospital beds. That means that if you're above this level, the death rate will be dramatically higher. But if you're too low, then the economy starts to sink. The question is how to find the trade-off. Of course, what we don't want is this curve, which is doing nothing, where the infection rate is very high and eventually the death rate is very high. Our 5 levels of response start with level 5. Level 5 is effectively closing schools for 2 weeks, having a strong response on communication, and that's it. And that is not enough. This is at the initial stages. The second level is closing schools for 4 weeks with a much stronger communication and starting social curfew. Again, we see that we're above the line. This is not enough typically. We start to have effective responses when we apply level 3, level 2, and level 1. Level 3 is the light stimulus. Level 2 is the strong stimulus. And level 1 is lockdown and life support that looks like this. What you notice here is that all 3 are below the hospital beds line. However, when you start to lock down, the question is time. Starting early is fundamental. But for how long? If, for example, you keep the lockdown for 20 days, you see that the curves goes back up at the end. That means that when the lockdown is over, we see a new bump. And our model is predicting the same logic across a number of countries. The question, therefore, is how to combine containment and support measures. There are 3 learnings. The first is ensuring that policymakers manage time effectively. When to start and for how long. The second is to ensure that you combine both containment measures and support measures. But above all, it's about communication. Communication to the wider public and dialogue with the private sector.